when it comes to dietary and food habits, I think what the traditional Indian diet and the traditional Indian teachings or the tenets that you have an early meal, you space out your meals well, you include a lot of fruits and veggies in your meals. Those things are definitely something that holds good. I think another very good aspect of the Indian diet was that it's always fresh. Our mothers always cooked fresh food for us. Most of us are yet lucky in India. I think a lot of homes still follow the same thing. Compare that with a Western lifestyle where I know that for example, some of our friends and relatives who stay there have their refrigerators stocked with processed foods because they just don't have the time. And I think slowly, if you see the very nuclear families, people extremely busy, don't have time to or access to freshly cooked food, are adopting more and more of processed meals. This is one of the causes of colorectal cancers. The additives that are added in processed foods, unfortunately, the emulsifiers that are added in processed foods are one of the carcinogenic agents. I don't mean to scare people, but unfortunately that's true.
It's the truth, yeah.
It's true. And that's one of the reasons that processed foods or refrigerated foods or these frozen foods are it's okay for an occasional consumption, but it's definitely a no for a daily consumption. Yeah. So I think that's something that the uber urban India, the millennials need to take stock of, because it's unfortunate again that we are seeing a lot of young patients coming to us with cancers, which we were not seeing 20 years back. It was usually a disease of the old people beyond 50s, 60s, 70s would come to us. The occasional patient would be young. Today in my clinic, 1 in 4 patients is below the age of 40. It's alarming because, and again, it's got to do with a lot of lifestyle issues. Apart from the fact that yes, there's genetics which has got a big role to play. There's the environment, there's pollution, there are a multitude of factors, but I think the diet definitely has a big role to play, and I think that's very important. Processed foods, a good balance of carbs and proteins and fat. Extreme diets are always a problem sometimes. The other thing that we notice is one of the flip sides of the typical Indian diet, which I see, is that a lot of our purely vegetarian patients are usually obese because of they've been having just carbs all their lives, and
but they were more active 10
years ago. They were more active, yes, they were. But at the same time, we do see that they have low reserves in terms of proteins. So a mix and match of carbs and proteins, I think, add to it a little bit of fat, and I think that would be your ideal diet with a lot of greens and a lot of fruits and vegetables, and healthy cooked meals. So one of the other factors for cancers is known to be red meat. Especially smoked red meat in high quantities is a known carcinogenic agent. And the other thing is, of course, obesity is one of the causes of cancer as well. Whether you look at colorectal cancers or pancreatic cancers, there's very clear evidence now that obesity and long-standing obesity or being overweight is one of the factors that increases the incidence of these cancers. And it's all got to do with more and more carbs that you keep loading in.